Hello, I am Myoung Kim from Department of Radiology at Samsung Medical Center. On behalf of my co-authors, I would like to briefly introduce our study published in the Korean Journal of Radiology. Breast ultrasound, background echo texture, and glandular tissue component are factors used to assess breast tissue characteristics. The background echo texture, or BE, reflects the balance between fibroglandular tissue and fat, affecting lesion conspicuity. The glandular tissue composition, or GTC, represents the proportion of glandular versus fibrous tissues within the fibroglandular tissue, and it is known as an independent marker for future breast cancer risk. Accordingly, in the recently revised 6th edition of ABUS recommends documenting BE and GTC in screening and diagnostic ultrasound reports. Automated breast ultrasound provides standardized three-dimensional whole breast imaging and multiplanar views beyond handheld ultrasound, and its structure acquisition reduces operator variability and enables more objective assessment of breast tissue composition, including BE and GTC. Therefore, the aim of our study was to determine whether breast tissue composition on preoperative ABUS is associated with the accuracy of assessing additional cancers and post-operative recurrence-free survival in patients with early breast cancer. Based on data from our institution's participation in a multi-center study evaluating ABUS combined with digital mammography for preoperative staging. 468 women with newly diagnosed early-stage breast cancer in our institutional prospective study underwent ABUS and hand-in-hand US with digital mammography to determine preoperative local tumor extent, followed by surgery were identified. And we excluded women with neoadjuvant chemotherapy and loss of follow-up. And finally, 409 women was included in our study. The three radiologists retrospectively reviewed ultrasound images independently. The background echo texture was evaluated in the control altered breast for all women and categorized as homogeneous fat, homogeneous fibroglandular, or heterogeneous. The amount of GTC was assessed by scanning entire breast for women with heterogeneously or extremely dense breast and mammography, and classified as minimal, mild, moderate, and marked. The primary endpoint was accuracy of preoperative patient categorization regarding cancer multiplicity as unifocal, multifocal, or multicentric, or bilateral. And the secondary endpoint was recurrence-free survival, defined as the interval from the date of surgery to the first recurrence or death from any causes. Here are the main results. This table represents characteristics of the patient in overall group and dense breast group. The premenopausal was more prevalent in the dense group, but otherwise was similar between two groups. Here we evaluated factors associated with inaccurate preoperative cancer multiplicity, categorization on ABUS combined with mammography. High BPE on MRI was the only independent factor associated with inaccurate multiplicity assessment. Other factors including BE and GTC and ABUS were not significant. This is the case showing high GTC and ABUS did not correspond to inaccurate preoperative cancer multiplicity assessment. This is the case of a 33-year-old woman with index irregular hyperdense cancer in left upper breast. And digital mammography shows heterogeneous dense breast tissue. Preoperative axial ABUS images of the contralateral normal breast show homogeneous 5-glandular background echo texture and a moderate glandular tissue component. Preoperative ABUS identified an index cancer in left breast at 2 o'clock position, and 2 additional suspicious lesions at 1 o'clock position which confirmed as invasive ductal carcinoma. The accurate evaluation of cancer multiplicity was achieved using ABUS in moderate GTC. Here we evaluated factors associated with recurrence-free survival. Heterogeneous background echo texture and high GTC on ABUS were independently associated with worse recurrence-free survival. And as expected, BRCA mutation, pathological tumor size, and final T stage were significant prognostic factors. This is a case showing association between background echo texture in ABUS and recurrence-free survival. This is 55-year-old woman with invasive ductal carcinoma. The mammography shows scattered density with an irregular hyperdense index cancer in the upper inner quadrant of the right breast. In preoperative X-ray ABUS of contralateral normal breast revealed heterogeneous background echo texture. And ABUS delineated the index cancer in the right breast at 1 o'clock. And 3-year follow mammography shows grouped linear branching calcification, and ultrasound reveals an irregular hypoacute mass with calcification. Biopsy confirmed recurrent invasive ductal carcinoma. This is another case showing association between glandular tissue component in ABUS and recurrence-free survival. This is the case of 46-year-old woman with invasive ductal carcinoma, but initial mammography shows extremely dense breast with no clear visualization of the index cancer. Preoperative X-ray ABUS of contralateral normal breast reveal a homogeneous five-gland background echo texture and moderate glandular tissue confidence. ABUS delineated an index cancer in the right breast at 11 o'clock position. 1-year follow-up imaging of the contralateral breast revealed an irregular hyperdense mass with microcalcification on mammography and corresponding irregular hypoacute lesion in ultrasound. Biopsy confirmed ductal carcinoma in situ in the contralateral breast. Here is the conclusion of our study. In patients with early-stage breast cancer, heterogeneous background echo texture and high GTC on preoperative ABUS, together with larger cancer size and BRCA mutation positivity, were associated with worse recurrence-free survival. However, background echo texture and GTC did not affect cancer multiplicity evaluation when ABUS was used in combination with digital mammography.